So for my technique, I have cervical combined range of motion. So in this case, we're going to combine flexion and rotation. Now, this is going to be important because it can help to provoke or recreate symptoms for patients where straight plane of motion hasn't necessarily recreated their pain or their symptoms. So to do this, what I'm going to do is I'm going to first grab the patient's neck here. I'm just going to grab your head. I'm going to pull you into lower cervical flexion, so full flexion here. Now from this position, I'm going to support his head with my abdomen. I'm also grabbing along the sides of his head. Is that okay? There's too much pressure?
No.
Okay. Now from here, I'm going to rotate one direction maximally, trying to keep him in flexion and make sure that I don't get into side bending or extension. And then I can go the other direction too. Now, you get any symptoms on the inside? Okay. So if he was to have neck pain, let's say it was right-sided, and as I turn right, we recreate his neck pain, that would tell me that his right OA joint would be kind of to blame. It would be what's creating the pain for him. If we go left, obviously the opposite is true. It would be the left OA that's not properly posteriorly rotating back. So one other thing that we can do with this flexion and rotation is that if I wanted to, I could also take the patient into extension and subsequently maximally extend, and I'm doing so with my hands here, and we can also rotate, where we might see improved range of motion either way. If it was that case, once again, we would expect that the OA joint, now being tilted into extension, has more freedom to move than when maximally flexed.